So, it's funny. I think people react to this notion, when I say structured therapy or whatever, as if it's kind of so different from dealing with, other people who might turn to food or some other chemical as at times of crisis. And so, the thing about the chemical copers is that they're very common in a big pain practice because, they dabble in overuse, like if they have a bad day at work or a fight with their spouse or things like that. But at the same time, they don't ever do anything, so heinous as to get themselves discharged. They don't crush and snort their pills and things like that. And so they don't really need a lot of attention to the out-and-out addictive kinds of behaviors that you sometimes see. It's really more that they need to be seen frequently. They need an approach to their medications that de-emphasizes pill popping. So, for example, long-acting opioids doled out in small quantities. How different is that than helping somebody who compulsively overeats or is a stress eater by saying to them, if you say to the person, I'm going to give you 180 short-acting hydrocodone tablets and they need to last you for the month, that's like handing somebody like me who's a carb addict like an order of Biggie fries and telling me eat 2 and put it down till tomorrow. It's not happening. And so, so they, portion management. But then I think the really important other aspect of it is that the approach, in addition to de-emphasizing the medication aspects, it doesn't mean don't provide it, and it doesn't mean nickel and dime them on the dose. The dose is the dose. It's the amount of medicine and the amount of pill popping that I'm more concerned about. But then finally, the approach has to involve psych, because you have to help people with their coping skills and with the emotions and sorting out their emotions and so on and so forth. And then the other part of it, of course, is that they need to be they have to have an approach that sort of activates them, gets them involved in behavior change, gets them in physical therapy or to a gym or a personal trainer, you name it, but something that helps them develop what I tell my patients all the time, don't exercise because your pain is going to feel better. Exercise because you need a well of vitality, because living with pain is demoralizing and it's depressing and it's exhausting. And so, you need to have that so that you just feel stronger to wrestle with this, over the long haul.